Hello, my name is Yolanda Huth, and I'm an Assistant Associate Professor at Louisiana University in Ruston, Louisiana. This presentation is about a service learning project that our students conducted in the wake of the COVID pandemic. The title of this project is Pandemic Project, Connecting with Older Adults in Assisted Living Through Letter Writing. When we're talking about nursing, one of the things that we do is patient-centered care. Patient-centered care, it involves meeting a client's physical, emotional, and spiritual needs through your knowledge and your skills. In providing patient-centered care, we form helping relationships. And in helping relationships, we're trying to establish a relationship with the patient in order to meet their needs. In the helping relationships, there's four phases. There's the pre-orientation phase. With the pre-orientation phase, this is when you're looking at information about the patient. This is before you actually meet the patient. So you're gathering information about the patient. You can be looking at their chart. You can be getting history from other individuals before you actually, meet the patient. Then you have the orientation phase. The orientation phase is when you do a face-to-face meeting with the patient. And in the wake of the COVID pandemic, we were not always able to do a face-to-face meeting. Sometimes we have to do it through, electronic devices like Zoom, or, we can come up with other alternatives like the letter writing. But with the orientation phase, like I say, typically that's when you make the first contact with the patient. And you learn stuff about the patient, about their goals, their problems, and the things that you want to solve. And y'all come up with a plan. You establish how the patient wants you to address them by their first name, their last name, and so on. Then you have the working phase. In the working phase, you're actively working with the client to solve whatever problems that they have. This could be mental problems, medical problems. This can be, a spiritual problem, just the fact that, they need somebody there with them. Then after the working phase, you have the termination phase. In the termination phase, this is when you summarize everything that y'all have discussed. You end your relationship by focusing on, things that you discussed, things that you talked about, and, what the patient can do to, further their spiritual growth, their mental health, and also their physical health. So, with the COVID pandemic, like I mentioned, we had to come up with innovative ways, and we decided to try to do letter writing with individuals that were in assisted living homes, because these individuals were isolated due to, the COVID-19 pandemic, us having to do shelter in place, and isolation. So we decided that we would try to have social interactions with these individuals, since they were isolated and they couldn't receive visits from their family members and loved ones. And when you're communicating with individuals, when you're trying to do your patient-centered care and doing that helping relationship, one of the most important things that you have to establish is communication. Communication is a two-way street. It's the best way for you to establish some type of relationship, clear communication. On this PowerPoint slide, it's just a slide that shows some of the students and the faculty members that were in the class that did this project. The student objectives, we had two objectives: to develop communication skills with older adults to decrease isolation through letter writing and receiving, and also to participate in letter conversation with vibrant older adults that had contributed to society. And on this PowerPoint slide, it shows some of the residents at the facility that participated in the letter writing. A lot of times with older adults, when they're in assisted living devices, they're kind of dependent upon other people. They're not out in the community, socializing and interacting with other individuals. And sometimes there's a stereotype that that they're not productive to the society anymore, which is untrue. They can provide valuable lessons for everybody to learn from, and to be a better person. Again, with the COVID-19 pandemic, there was a lot of restrictions regarding the nursing students being able to go to do face-to-face care. So we decided to try something different to still form interactions with our clients, especially the clients in the senior living facilities. The way that the project worked, the nursing students were assigned to write a series of 3 conversational letters to an older adult residing in an assisted living environment. The letters were written over the course of 2 months during the quarantine and social distancing due to the COVID-19 pandemic. Students were provided a template which gave them a starting point and instructions regarding what to include into their letters. There was a contact person from the facility that provided the faculty member, which the faculty member provided this information to the student, the information about the patient's interests, their accomplishments, their room numbers, and any information for them to use in that pre-orientation phase before they do that initial contact and to be into the orientation phase. The letters were submitted electronically to a faculty member. That faculty member reviewed the letters and printed the letters. Then that faculty member delivered the letters to the designated person at the living facility, using their guidelines and instructions of how they wanted us to present the letters. Then the staff member at the facility delivered the letters to the residents with their regular mail. Any residents that chose to return letters to the students was done in reverse fashion. For as the letter content, the delivery, and the return procedures, this was all done in compliance with infection control, HIPAA, and FERPA. And this slide just shows an example of one of the letters that the students wrote. And if you look at the letters, it's in different color ink because they wanted to, make the letters attracting and upbeat and warm. And, they wanted the residents to be happy when they, first initially opened up the letters. And they gave them, different pictures, and they also, gave them sayings. Some of the students presented pictures also. And this right here just shows like two of the letters that the residents wrote back. And if you read the content in the letters, you can tell that, these individuals were very happy, to receive the contact from the students. One of the letters, the resident told the student, my name is Mary Elizabeth also. And I think that student's name was Elizabeth. So that's something that they had in common. And in the letters, they talked about their appreciation for the students, reaching out to them. They gave stories about things that they did in their past, their jobs, their interests, their hobbies, the stuff that they do at the living facility that they were at. And they were very, very appreciative and very pleased to receive the letters, from the students. So again, the process that we conducted, we wanted the students to still be able to have a helping relationship with their patients, even if they couldn't do a face-to-face meeting. And this is our references and our contact information. Again, my name is Yolanda Hoof, and Sarah McVeigh and Sherry Robertson were the other 2 faculty members that participated in this project.